Welcome to Cancer Clear and Simple, the podcast where we bring clarity, compassion, and connection to the cancer conversation. I'm your host, Joshua Wright, and today we're coming to you from a very special place, the annual open house at the UW-Carbone Cancer Center. This event is all about learning, listening, and bringing our community together, and we wanted you to be a part of that too. In this episode, you'll hear voices from all walks of life. People sharing what they know about cancer, what they want to understand better, and maybe something you might want to know too. From prevention and screening to questions for medical providers, this is a space for honest, real conversations. Whether this is your first time with us or you've been tuning in for a while, my name is Joshua Wright, and welcome to Cancer Clear and Simple. Thank you so much for joining us today. And so we're here just talking about the open house and the Carbone Cancer Center. What is it that you think of when you hear the word cancer?
When I hear the word cancer, I think it's kind of like a scary thought. Like I think of like sickness, I think of chemo treatments, surgeries, just like a bunch of scary thoughts like that. What about you?
I would say it's like mixed emotions. I have that like, I don't know, scary thought of it as well, but I'm also like currently in the medical physics graduate program. So I also kind of like have over the past couple of years, like learned a lot more about it. So it's kind of a more familiarity as well of like more familiar with like the treatment. So I guess that kind of makes the scariness a little less.
Okay. And I don't know if I've heard of the two terms medical physics put together. Mm-hmm. Can you tell me a little bit about that?
Yeah, definitely. So medical physics is has kind of two parts to it. So one part of it is radiation therapy. So medical physicists often help radiation oncologists in creating radiation treatment plans for patients and kind of making sure that the doses that patients are getting to any tumors are accurate and like as safe as possible. And then there's another aspect of it, which is kind of supporting imaging. So like X-rays, CTs, MRIs, medical physicists help to make sure those machines are operating well and do quality assurance checks for those.
I'm amazed. That sounds really cool. Can you tell a little bit about how you got interested in that field?
Yeah, definitely. So I did physics degree for my undergrad. And in that, I kind of did some experimental physics labs where we did some related to medical physics. So we did a PET lab one time where we had kind of this mini PET like type of setup, which stands for positron emission tomography, which is kind of a complicated term, but it's like a type of imaging. Okay. And I found that really interesting. And then I also just really liked the real people, like getting to help people aspect of it. So I was able to like apply physics to help people with just like being able to use my physics knowledge, but have a more real life application versus more abstract concepts.
So yeah, that has me really excited with you because I see the excitement in you. Can you talk a little bit about what you know about screening for cancer through your training as a medical physicist?
So we've learned about a few different cancer screenings over like the course of my classwork. One thing we learned about was mammography. So kind of getting x-rays of breast tissue in order to screen for breast cancer. So we learned about that. Kind of also know about like pap smears for cervical cancer, colonoscopies to kind of see just like regular checks of colon to make sure there's no types of things going on there. But yeah.
Okay. And so this is a different conversation than I usually get to have with people because, again, just the removed stance from cancer screening. But how would you describe to somebody the difference between screening and testing?
I would say screening is more of a preventative measure. Okay. So it's kind of like something that we like would encourage everyone to get done. It's just like a preventative measure and kind of like looking for something, even if we're not sure if something's there. And then I guess testing would be more like there's more of an indication that there might be something wrong. And so kind of going to get a test, a biopsy, something like that to test for that.
Okay. That's very accurate in terms of how I understand it as well. And so Can you tell us, like in your own lives, where you come across cancer or anything that, you've been exposed to as far as cancer in your outside of your training?
Yeah. Do you want to go first?
Yeah. I think my first like exposure to cancer was when when I was younger, someone a year above me had cancer, and it was like kind of a scary thing because I was like really young and I didn't understand it. But yeah, she made it through and she's cancer free now. And then our uncle also had cancer too.
Okay.
Yes.
Okay. Do you know any specifics about your uncle's cancer, like what kind it was or when he was diagnosed?
He was diagnosed with leukemia probably about 3 years ago, I think.
Okay.
Yeah.
Okay.
Yeah. He he had Crohn's disease before hand, and then like later years of his life he was diagnosed with leukemia and went through some, I think it was radiation treatment.
Yeah.
Okay. Okay. Who talked to you about that? Was it your uncle specifically, or?
I think it was probably our dad.
Yeah.
So it was our dad's brother who
Okay.
had the cancer. Yes.
Okay.
Yeah.
Okay. Do you remember, or can you share a little bit about what that conversation was like?
I don't really specifically remember. Our uncle was like sick a lot. He had a lot of health issues, so I don't remember like the specific conversation we had. But yeah.
Yeah, I remember hearing about it in kind of more vague terms. I think there was we talked about how it was more palliative and how he would kind of have to go through this maybe for the rest of his life, even just like coming back for short-term treatments.
Okay. Okay. And from there, like, did you have any questions that you ended up asking from that place?
I would say yes. I think because there wasn't a lot like that I knew about the treatments that he was going through. It was actually an interesting time in my life because I was trying to figure out what I was going to do with my career. And I think that like seeing him kind of go through that kind of reminded me of like that passion I have to help like people who are going through like disease and sickness. And it was actually about when I was like applying for grad school. So I remember like when I was thinking about applications and thinking about my potential future and like helping cancer patients, he was on my mind a lot, and just like wanting to learn more about what he went through with treatments.
Wow. Okay. Okay. And so what advice would you have for somebody who is learning about their family member getting a diagnosis?
Something that I leaned a lot on during that time was like prayer. Like that's something that's really important to me. And like, I don't know how like a lot of people would get through like those difficult times without like, if I didn't have my faith. I think that would be really hard for me to get through those. And I know like I trust personally in God to like bring people through those tough times. And I just kind of put it in his hands and would pray for healing for my uncle. But that was just what I did. But obviously each person deals with different things like in their own way. So
yeah, I would say also don't be afraid to ask questions about what's going on. It can seem really overwhelming at first, but I think like finding that healthcare person that you can like ask questions to kind of explain the treatment, like what's going on, can make it seem a lot less scary.
Yeah.
I know like having just that knowledge and support from them can be super beneficial.
Okay. Okay. Were there any professionals that you were able to talk to ask questions of during that time or with your family?
Not really for me. What did you?
Yeah, not really.
I just kind of asked like what was happening like with my like our family members, like what was going on, because I was kind of confused about the whole thing. I wasn't really sure like what he was going through and stuff like that. So just like asking like him or our family members that have been visiting him a lot, like asking them about what was going on. But
Okay. Did you have any understanding about the difference between blood cancers and tumor cancers?
no.
I did a little bit. Yeah, I think I had a little bit of an idea, but I think like as I've gone on and learned more about cancer in my classes, it becomes more clear. But I think like in general, they kind of all get lumped in your head in the same category, even though there's like some differences with them.
Sure. Okay. And then just in terms of like your own kind of healthcare journey, what approach do you have to cancer screening?
For me, I feel like that's scary for me to even think about. I know it's like important to get screenings and stuff, but I don't really think that I've undergone any screenings, which I probably should, but have not. So, yeah.
Yeah, I think it's really important to be like screened whenever like healthcare professionals are recommending it. I think like like my plan is to like continue to to get cancer screening as like I approach the ages where like different types of screening are recommended. And like a lot of times you can hear about that from like your primary care doctor. They can like make sure you're on track with cancer screening. So yeah, I think it's important to like, it seems like it might be like far away, or like you can just put it off a few more years, but I think it's important to like stay ahead and in order to prevent that, because then the earlier that you can screen and test for it, the better outcomes there are. So yeah.
Okay. Well, I just have a couple did you know things. And so did you know that UW-Carbone is home to more than 300 cancer researchers and physicians working across a wide range of cancer types?
That's a lot.
Yeah. So, and again, it's just the makeup of the Carbone Cancer Center. You know, we are a NCI, National Cancer Institute, comprehensive cancer center, meaning that we do the range of cancer things here, from treatment to diagnosis to prevention to outreach. And so that is something that we really pride ourselves on. And part of that is that we get to have this open house that we're doing. And so can you tell us a little bit about how you heard about the open house and what you've experienced here?
Yeah, so I came in for the weekend, so I'm not actually from the area, but Carly, I came to visit my sister, Carly. Her friend was telling us she is doing like a little booth here. We haven't gotten to visit it yet, but we saw her when we came in.
Yeah,
and so we kind of
part of medical physics and radiology, and so she's doing a demonstration that we wanted to check out.
It looked like she was giving CTs to Barbies from a distance. That's what it looked like. Yes, with the kids. And so that's how we heard about it. She told us last night if we wanted to stop in, say hi, see what was going on. So we didn't really know about it or what to expect, but we just came in, and it's really cool, like all the blow up demonstrations.
Yeah, it's a very big event.
Mm-hmm.
Okay. Can you de-acronym the word? So just so I can have an understanding. You said a CT. She has a booth about CT scans.
Yes.
Mm-hmm.
I'm going to direct that to you.
Yeah, that stands for computed tomography.
Yes.
So it's a type of medical imaging scan that you can get. So it's basically like, in a way, like a 3D X-ray. So it's kind of like an X-ray that kind of like circles around your body, and then you can get a 3D view of like the inside of you, basically.
And she's doing this for a Barbie?
That's what it looked like when we were walking by.
And she's doing a demonstration.
Demonstration.
So, I don't think she has a really tiny CT, but
okay. I was really excited. I was going to run out.
I think it was just like a model. Yeah.
Okay. And so what kind of things would you suggest in terms of other people, in terms of asking questions, or when it comes to cancer?
I would say just like talk to people you know who are going through this, get their experiences, and be there to support them if you like have someone in your life who's experiencing this, because it can be a tough and scary time. And then also just like stay informed, continue to get cancer screenings whenever your doctor is recommending them to you. And then just it's important to like stay informed, so that, because it can feel like a really overwhelming thing at first, but a lot of people in your life and maybe in the future might experience cancer. So so I guess just like asking questions, because the more you know, the more you can help others and less overwhelming it will seem.
Okay.
Well said.
Did you have any questions for a medical provider that you want to throw out there?
You got anything?
Are there any like specific warning signs that you would be looking out for to maybe like you would need to get a screen or a test for cancer?
Okay.
That would be my question, I think. Because I wouldn't know what to look for. Like if I needed to get tested, I don't think I would know.
Mm-hmm.
Okay.
So.
Okay. And I just would leave with this kind of nugget in terms of the difference between screening and testing. Screening is before we have symptoms.
Yeah.
right? And so you definitely alluded to that earlier when I asked, which was great. And then being able to test is when something's happening. So when you're talking about it, it'd be testing because it's like, okay, there's something going on, but we don't know what's going on, right? But what is that symptom and what does it mean? Okay. But yeah, definitely I appreciate you for outlining that because that is a very common thing that, we want to be able to have a starting point of having this conversation. Yeah. And so I want to say thank you so much. And I'm going to try very carefully not to get you confused. And Carly and Cory.
Yeah.
Cory. Is there another C name person in your
Cooper is. We are.
There's a Cooper.
Yep. Our younger brother's named Cooper.
Yes.
Okay. Okay. Thank you so much. If there's any other parting words or words of advice that you would like to share.
No, just thank you so much for having us. It's very cool that you're doing this podcast to inform people about cancer.
Yes.
Thank you so much.
Thanks for having us on.
Absolutely.
Lovely to meet you guys. So.
All right. Thank you so much for joining the Cancer Clear and Simple podcast. Please tell your family, friends, and loved ones to tune in, and we'll catch you on the next episode.